If you didn't know, just a few decades ago, when someone was considered insane, doctors would drill a hole in the front of their skull, slice directly into their brain, and sever the neural connections between the thinking center and other regions. In the past, treating mental disorders was often arbitrary, and some might say, downright inhumane. This brutal procedure was known as lobotomy. But how exactly was this procedure performed? And just how horrifying was it to earn the title of the most ruthless medical treatment in history? Let's find out in today's video. This was perhaps one of the earliest known treatments for mental illness, also referred to as trepanation. In a lobotomy procedure, doctors would drill a small hole into the patient's skull, make an incision into the brain's lobe, and then decisively sever the neural connections between the thinking center and other areas of the brain. The goal of this procedure was to calm mentally ill patients by damaging or cutting through brain tissue in the frontal lobe, located at the front of the brain. This was based on the old belief that mental disorders were caused by excessive emotions and overreactions. Therefore, severing the prefrontal lobe was thought to eliminate these unnecessary emotions and responses. In doing so, patients would become calmer and easier to control. What do you think about this? As for me, it reminds me of that eerie little story about the kitten who wanted to stay home from school because its tail was sick, only to receive a chilling response from its mother: "Cut it off and it'll be fine." As absurd as it sounds, historical records suggest that this treatment dates back as far as 7,000 years ago. Although no complete medical texts or diagnostic manuals from that time remain, experts speculate that this practice of removing a small portion of the skull might have been used to relieve headaches, mental illness, or even symptoms believed to be caused by demonic possession. And despite how cruel the lobotomy procedure may seem, it was still groundbreaking enough to earn Portuguese scientist Antonio Egas Moniz the Nobel Prize in Medicine in 1949. At the time, lobotomy was even considered a brilliant medical breakthrough. At the award ceremony, lobotomy was praised as one of the most important discoveries in psychiatric treatment. Because of this, the procedure became quite popular in the late 1930s and continued to be widely used until the mid-1950s as a way to reduce overcrowding in mental hospitals. This form of brain surgery was commonly performed on patients suffering from mental disorders such as schizophrenia, depression, bipolar disorder, and post-traumatic stress disorder, PTSD. Hearing about lobotomy might sound vague and abstract, but would you like to know exactly what happened during one of these procedures? Because the details are far more terrifying than you might think. In the early days of lobotomy, the procedure began with drilling a hole in the front of the patient's skull. Through this hole, doctors would inject ethanol to destroy the nerve fibers in the frontal lobe, fibers responsible for connecting this part of the brain to the rest. The procedure continued with a thin wire, which was used to saw through the front of the brain. To achieve this, the wire was carefully threaded through the hole and tightened around the targeted brain tissue until it was completely severed. If you think this method was already brutal enough, well, Walter Freeman had something even more horrifying in mind. Since a thin wire wasn't always strong enough to cut through the skull and brain tissue, Freeman, instead of using a wire, introduced a sharp metal tool, something resembling an ice pick or a flathead screwdriver, to slice through the frontal lobe. But the real horror? This tool wasn't inserted through the skull, but through the patient's eye socket. Thinking about anesthesia? Forget it. Instead of being given painkillers, patients were simply shocked into unconsciousness using high-voltage electroshock therapy. From an ethical standpoint, lobotomy is undoubtedly one of the most barbaric procedures in medical history. But here's the real question: did it actually work? Unfortunately, the answer is a resounding no. Lobotomy was not only a dangerous procedure, but it also offered no real benefit to patients. At first, people mistakenly believed it was successful because patients became calmer. However, this calmness did not mean they were thinking more clearly or feeling better. It meant they were completely unresponsive, both mentally and physically. A neurologist and psychiatrist named John B. recorded the case of Dines, a lobotomy patient who, after the surgery, acted exactly like a lifeless body. Dines lost the ability to speak, move properly, think, and even sense what was happening around him. Families of lobotomy patients reported that their loved ones would sit and stare blankly at nothing all day, showing no emotion or awareness. Most patients spent the rest of their lives in mental hospitals because they could no longer eat, walk, or take care of themselves. The reason for these horrible effects? Their frontal lobe was completely damaged. This part of the brain is responsible for decision-making, movement, planning, communication, emotions, and self-control. Even worse, many patients died right after surgery due to severe brain bleeding. It's a tragic reality, but when compared to living the rest of your life as an empty shell, it's hard to say which fate was worse. Thankfully, by the late 1980s, lobotomy was finally banned and completely abandoned. Even before that, in the 1950s, doctors had started developing medications to treat mental disorders. This new approach gradually replaced lobotomy, putting an end to one of the most cruel medical procedures in history. Today, people with mental health conditions are treated with antidepressants, antipsychotic drugs, therapy, or a combination of both. There's still no instant cure for mental illness, but modern medicine is far better at managing symptoms and helping patients live normal, stable lives. By now, you've probably been shocked by the horror of lobotomy. But here's the thing, it wasn't the only terrifying medical treatment in history. In fact, some were so disturbing that you might wish you had never heard of them. Take trepanation, for example. Like lobotomy, it was one of the earliest forms of brain surgery, dating back to the Stone Age. This procedure involved drilling a hole into a person's skull, a practice that was surprisingly common in ancient civilizations. It was believed to be a ritual to drive out evil spirits, which were thought to be the cause of illness. Sounds ridiculous, right? But trepanation is actually still performed today. With modern medical advancements, doctors now drill directly into the skull using specialized tools and techniques to treat brain injuries, such as internal bleeding, head trauma, or strokes. Another reason blood is removed from the body is to treat hemochromatosis, a disorder where the body absorbs too much iron from food. Excess iron gets stored in organs and tissues, becoming toxic to the skin, heart, liver, pancreas, and joints. To this day, blood removal remains the only treatment for this condition. Doctors use a needle to draw blood from the patient once or twice a week for several months, gradually lowering their ferritin levels, a blood protein that stores iron. Interestingly, this process of removing blood is also believed to restore balance in the body and help with other conditions. Now let's talk about ECT, electroconvulsive therapy. It first appeared in the 1930s and is possibly one of the most brutal medical treatments in history. This therapy sends electrical pulses into the brain through electrodes attached to the patient's forehead, or in extreme cases, directly implanted into the brain. The biggest issue? Patients were given no anesthesia, and the electric shocks were incredibly strong, causing severe pain. Despite its harsh nature, ECT is still used today, but under safer conditions. Now patients receive general anesthesia, and the treatment is administered 3 times a week for 3 to 4 weeks. Why is it still used? Simply because it's far more effective than antidepressant medications. However, it comes with serious side effects, including memory loss, short-term cognitive issues, headaches, nausea, and even heart problems.